My name is Bob Rich. I am a certified prosthetist orthotist with Coyote Prosthetics and Orthotics in Boise, Idaho. And I'm going to be going over the wear and care instructions for a suction style prosthetic socket. This particular style and type of socket is good for new amputees because of their healing residual limb at the bottom. And it's good for a number of different types of people that can't tolerate too much pressure on the bottom. Sometimes the prosthetic umbrella that a locking liner has can cause irritation, so it's indicated in that case. Using a suction style prosthesis is much the same as the locking prosthesis. First off, let's start with the liner. Now a liner that you'd use with a suction style suspension is going to be a cushion liner. In order to roll on the liner, it should be flipped inside out and then rolled back onto the skin, pulling up with your hands. If you tried to yank the liner up like so, you risk getting folds in the liner and it could pinch or irritate you throughout the day. After that, you'll put your leg into the socket like so, and then you'll roll up a suspension sleeve. The suspension sleeve is what holds the prosthesis to your leg. So it's important that it be rolled up onto your thigh appropriately. When donning the prosthetic sleeve, it should be done with the larger width first and then the tapered end at the bottom. It just makes it easier to slide on. You'll want it inside out so the fabric goes against the socket. You'll push it down until you're about midway through the socket, and then you'll fold the lower half of the sleeve so it contacts the socket. After you do that, you can start rolling up the suspension sleeve. So just to recap, after you have prosthetic liner on, you'll don it and put it in the socket as follows, and then you'll roll up the suspension sleeve onto your thigh. Now there should be about 3 to 4 inches, so about this much, rolling up onto the thigh above the prosthetic liner. If you do not do that, you risk having a poor suspension. So let me just demonstrate here. So if you do that, the suspension sleeve's now at the top of the liner, and you risk going up and down and not having enough grab and losing air in the suspension system. Now the air will evacuate out of a valve in the socket. These valves can be cleaned using compressed air and should be checked regularly. If you suspect a problem with the valve, you can go to your prosthetic provider and have them test it. If the valve is broken, it should be replaced. Skin checks should be done daily after removing the liner. Inspect your limb. If you can't get to the whole limb, you'll want to have either somebody else inspect it for you or get a mirror to inspect it. And what you're looking for is any redness or abrasions or blisters that pop up. At times they can occur over the bony prominences of the leg. Sometimes they are completely random and have to do with fluid fluctuation. If there's redness, it doesn't go away within about 15 minutes. That's usually a sign of a hot spot, and that should be brought up to your prosthetic provider and addressed immediately. As far as exposure to the elements, water is generally a bad thing. So staying away from swimming and exposure to chemicals or any other thing, what that will do is it will corrode the components of the prosthesis, and you want to avoid that corrosion. Now there are some cases where people will have prosthetics dedicated specifically to water use, and in that case the corrosion can just be cleaned off, but in an everyday prosthesis, you shouldn't have too much exposure to water. Dirt and sand are the same. You should try to clean off your prosthesis if you get exposure to any dirt or sand. If you have any sort of electronics in your prosthesis, that should be addressed with your prosthetist beforehand, and you should be aware that you're not able to use it with dirt, sand, or water type of environments. Now, things to look out for in this system, because it is based on suction, any air hole that you get in the sleeve will result in loss of suspension. So if you find that you're pistoning or moving up and down a little bit too much, you might check your sleeve, your suspension sleeve, for small holes. Even a small pinhole can cause a leak. If that's the case, you'll need to see your prosthetic provider to either get a new sleeve or have a sleeve exchanged, or change the sleeve out yourself. As far as the wear time and break-in, it is much the same as a locking prosthesis. If you're a new amputee, obviously you'll want to break into it more slowly, probably around an hour a day, and it just depends on your particular case. As far as the care of the liner, flip the liner inside out. You should just use a mild hand soap. Move the soap back and forth, rinse off all the soap, run it under running water, and soap it off, and you can either towel dry it and flip it back inside out, or you can leave it to air dry until it's completely dry and then flip it inside out again. You're always going to want to have the fabric on the outside. If you leave the gel exposed too long, it can develop cracks. Sock ply management can be a little tricky, especially for new amputees. And you can expect that your limb will be constantly shrinking, even after you've been an amputee for several years, but it just shrinks more slowly. But if you feel like there's too much movement in the prosthesis, you might need to add an additional ply sock. Ply socks come in different thicknesses, and they're color-coded. This particular ply sock is a 3-ply sock, and it's color-coded with a green color. The ply socks are donned on the outside of the prosthetic liner prior to putting it into the socket. Now, if there are excessive plies, there will be too much pressure over the bony prominences of the leg, and it can be uncomfortable. If there's not enough plies, you might get too much movement inside the socket. If you have about 8 to 10 ply of socks, you might need to see your prosthetist for other padding adjustments and may need to get another socket. For transfemoral use of a suction system, there are different types of suction systems for transfemoral amputees. You can use straight skin suction. In that case, you'd use a donning sleeve to pull into the socket. Or you can use a wet fit system where you spray down your leg and come into the system. The valve here at the bottom is a little bit larger than on a below-knee prosthesis, but you'll pull in here, you'll make sure the skin is visible through the valve hole, and after you see the skin and after you're down completely and you're bearing weight on the prosthesis, you'll screw the valve back in. The same principle applies. Your leg provides the seal. In some cases, you'll have a sealing liner with a seal ring on it, and you'll have to spray it down to be able to get into the system, and air will expel and it won't let you get back up. If you find that you are pistoning or you're losing suction, you'll need to contact your prosthetist and see if there needs to be an adjustment. If you've lost a considerable amount of weight, that could contribute also to a poor fit. Sock management is also much the same as in a pin system. Wear and tear of a suction system, there's a few weak points. And like I said before, the sleeve is one of them. So if there's a hole in the sleeve or a hole in a seal somewhere, you're going to have a loss of vacuum. If you're using a seal band system, If your volume is fluctuated such that it doesn't fit anymore, your limb is shrunken, that could also cause loss of suspension. In that case, you either need to make it up with sock ply or you need to get into another socket. Within the first 1 to 2 years of wearing a prosthesis, new amputees will generally go through around 2 to 4 sockets, depending on how quickly they shrink and their volume stabilizes. The other weak point is the valve. So if the valve has any dirt or sand in it, it can be removed in most cases and cleaned out with an air hose or with something else. If the valve is bad, it should be replaced and you need to see your prosthetist. Any other issues with fit or sock management should be taken up with your prosthetist. Again, it's important, can't stress enough, that you do daily skin checks on your limb to prevent further injury to yourself.